then she can go out and get the 3 informal quotes and all that good stuff and get that ball rolling.
Okay.
Anything else you guys can think they need?
Is there certain, they need to go in for handicap?
I think there's a handicap on both sides.
There's handicap on both sides, north and south.
Okay.
What would make more sense probably is the north side. And then they're coming right in, right there where our nursing area is.
First of all, we're only going to be able to use the south side eventually because they're going to have a sheriff there. There's only going to be one entrance.
Oh, I did forget about that. Yeah, this commissioner said that they're going to shut down
Oh, that's right.
everybody to the south side. So we'd probably designate them on the south side then. They're both ramps entrances though.
Okay.
Huh?
The south side has 4 steps.
No, it doesn't. It's a ramp in.
No, from the sidewalk parking up to the building.
Did go back.
We'll have to look.
Okay.
No, I was just thinking, so we have the proper parking, one for
Yeah.
handicap people, and secondly, to make sure that they can get in the building
I
okay.
think that's why we talked about the south side, but then we went back to the north side because the veterans entrance is right there. And there's no, I forget about those 4 steps to get up to where the ramp is at.
That's kind of a bad deal.
Yeah, so we need to just make sure that we have handicap
Yeah.
accessibility.
Yeah.
And we make sure that the signage maybe even says, for health department, handicap.
Yeah.
That kind of thing.
Mhm.
So it's easier for them to identify where they need to park for the health department.
That's all I have on the move, unless you guys have any other questions.
Anyone?
Are we going to put, I guess we'll put something on the website too, that about
Yeah.
the moving and all of that? Okay.
Who does the website? Who?
I'll give you the number.
Okay, thanks. I'm still trying to learn everybody and what they do.
Is the person that does the website, just so I know, is that Val?
No,
Oh, okay. I don't know either.
I'll send it to you too. real quick. Okay, new business administrator position.
So yesterday we did interview for the health administrator. When we set up to do interviews, I first went to Dana and asked for all of the resumes that had been submitted previously for the position. Julie and I went through all of them. We kind of started by just seeing who met the qualifications. There was a lot that did not, a lot that didn't have any kind of degree outside of a high school diploma. Some had their associates. So we got it down to about 5 candidates that had their bachelor's degree and the required management experience. And then from there, Julie made phone calls to see who would still be interested, because a lot of these applications were from 8 months to a year ago. And so we were successfully, one told us right away he's not in a position to leave his current position. We talked with 2 others that returned our phone calls. And then one, we had set up 2 interviews, and then one had withdrawn before the interviews occurred. So we did have the interview yesterday with the candidate that I sent out her resume to all of you. Her name is April Hicks. She currently is at Echo Housing or Echo Community Clinic in Evansville, setting up a program for homeless individuals for permanent housing. She's done several different things. And as somebody had pointed out, that she has kind of gone from place to place, which is honestly probably the one concern Julie and I had talking with her. And so we did talk with her about, this is something that Julie is here in the interim to kind of help build things back up, get things kind of sorted out, but we need somebody, here long term. So we did specifically discuss that with her. And she did indicate that she is looking for more long-term position. Is that the same takeaway that Julie had with it as well? As you can see on her resume, she does have a bachelor's in business administration and management. She also has her associates first. She got that in marketing and advertising. And then she's done a lot, like I said, with different startups, managing people, grant writing, managing grant funds, budgeting, all those type of administrative things, both in the healthcare world and non-healthcare world, for-profit and not-for-profit world as well. So the both of us feel like she's a good candidate. her and I got along very well with her. Her interpersonal communication skills were very good. So we would like to move forward with hopefully offering her a position.
Did she give you any reason why she moves around so much? Because every year to 15 months,
Mhm.
she's moving on.
I think kind of you want
One of her things is she goes in and she sets up these places to do.
Tell who you are.
Oh, I'm sorry. I'm Julie Shade. I'm the contract administrator for Warrick County Health Department. So she goes in and she sets up these places and she helps them get started. And once they get where they need to be, they hire somebody to come in. So it's kind of like she liked doing that. And she was from Tennessee. So she kind of like moved and did that. But she was originally from here. And so it's something that she wanted something more permanent. And that's why she had applied before. Something to stay with, to grow with. And that's what she said she wanted. She's tired of doing the setups and then moving on. So
Do you guys have questions or anything regarding their potential appointment?
I don't think so. I got to preview her resume a little bit before the meeting, and I'm in favor.
Do we need to do a motion? Do we need to
Recommend.
recommend?
I think my understanding is the administrator appoints, or the health officer appoints the administrator.
Okay.
I think you make the recommendation. You guys can give your
Just endorse
blessing.
more or less.
So we don't have to take it then to the county commissioners and everybody.
I will confirm that you do not need to, because I know there is somewhat of a unique process that was set up last year. So I need to look at that for hiring, just to make sure we follow it. Just to be safe, if you guys want to approve their recommendation of this individual for the administrator position, and then subject to whether or not it has to go in front of the commissioners, which I'll confirm and follow up with you guys just to make sure. And then if we do have to, we'll put it on the next agenda. But if not, then you guys can work towards a contract and all that.
and we did talk, just so you guys know, about we don't want to have somebody and then have them leave and have to train somebody
we
else.
did.
So
Yeah,
I
we
feel
did bring that up.
her confidence and how she talks and everything. She.
Oh, it does. Okay, I was hoping you'd be.
So that's something that we took in consideration with that too. It's not something we're taking lightly, not just because we had just her, because we talked about, advertising again and hiring, I thought about all that and doing that. So.
So
if-
could you explain how the transition will go from the new hire to your role in the temporary position? What's going to be the overlap, the timing, all that, since really we'll be paying twice?
Well, right now, I'll give you my update here in just a little bit, but just getting things restructured there and then helping implement that with her. Timeframe, I don't know. I don't want it to be long. I want to do this as quick as possible. So I'm hoping, myself, I would like to be done in a few months, but I'm contracted for a year. So if they need me, I can help and do whatever needs to be done. But it might take a little bit longer just because of the issues that we have over there and the structure that we need to redo at the health department as far as financially and all that.
And we don't believe, or you don't believe, that they're reopening the search for other potential candidates would be worthwhile since we have this 1 year runway.
I mean, we could.
And we could, yeah. I mean, she was very well qualified. She seemed to understand and know what she would have to do. We were very upfront with her about how much we need to rebuild here, and she seemed more than willing to kind of tackle that.
Very knowledgeable. Very.
Yeah, I just think the
Yeah.
question had to be
Yes.
asked.
Yeah, no,
Uh-huh.
that's good.
I
Definitely.
personally would love for you to have somebody else compare her to. When I read her resume, I think she's got the skill set. I don't see this person as staying and seeing it through. And I think there's been so much turmoil and the need to have a good, strong foundation. And I'm just going to tell you, if I was hiring, I wouldn't hire her unless I saw other people. So that's just my suggestion. But she's got a skill set, but is she going to get you where you need to go? And that's where my concern is, because things, when you're new in a role, it takes about a year to 2 years to really get things solidified and going forward. And if this is somebody that's only going to make it a year, you're just going to get started and feel good about it, and you're going to start to search all over again. So I personally would like to just put it out there one more time and make sure that this is the right person and that there's not somebody else.
Yeah,
I don't think we get to make the decision though.
No.
I think
No.
ultimately it's your
It's, yeah.
decision.
And
But we're just trying
talking
get
to the
people-
other applicants and looking at them and seeing what they had to offer,
'Cause she
that
has
also
the
helped as
process.
well.
Yeah, I think that's the way I understand it. It's Dr.
It's
Fry's.
recommended, but I think the commissioners still have to do the final
Yeah.
approval.
Yeah,
So I don't know where the funding comes from. I'm gonna ask her.
yeah.
I don't
Since she
know
knows the
what
procedure.
Yeah, we,
list of claims that.
I mean, we had probably at least 20 applicants. But
Through them.
the vast majority did not meet the requirements.
Right.
And talking to the 5 that I called and talked to, knowing what I know and what I have to do and what I have done, just her confidence and the answers that she gave me versus the 2 we were going to hire, the one I already knew just by talking, that this one was the
Interview.
better qualified. So when that's just my opinion with it, I don't want to waste time, my time, money, Warrick County's money either. But the confidence was there, backbone is there, structure as far as knowing what she knows and the answer she gave us. I feel like she's very qualified to do the job.
I do think he's going to come back and give an answer, but Dr. Carr, I do think it's your call.
Okay.
Yeah.
So,
Yeah.
the problem we had before is that the health officer had identified somebody, but the commissioners didn't endorse that person. So it wasn't the board.
No.
And in Gibson, I have to go before
So
council.
you guys
and
approve,
commissioners too.
you guys approve first, then.
We do have to approve that.
Okay, so that's,
It's a recommendation by the health officer.
Yes.
You approve and then it
Okay,
goes
all right,
to
then I stand
the
corrected.
denier.
That's what I wanted to confirm.
Yeah.
Do I have a motion? Do I have a not motion?
I'll make a motion for the hire to support our new health officer.
And I'll second that.
Any further discussion, questions? All those in favor?
Aye.
Any opposed? You can send that up to the commissioners.
thank you.
We want her to be good.
Yeah.
I think she'll be good.
I do
Yeah.
too.
I think she'll be good.
Contracts with Vanderburg.
So we received 3 different contracts. One was for PRETA 3, one was for STI testing, and one was for lead testing as well. I did read through the contracts. Julie and I have discussed it. We would recommend go ahead with proceeding with the PRETA 3 and the STI testing. We would recommend not proceeding though with the lead testing because we can use resources from the state for free and not have to pay Vanderburgh County to come do the lead testing. And when we talked to Sarah about how many do we normally do in a year, it's about 2. So that's something that we could potentially just save some money on from giving to Vanderburgh County, utilize the state resources like we have before.
Are you going to use the health promotion one and just take out smoking?
I did not receive that one. I got PRETA 3 and I got STI testing and I got lead testing.
Okay. I'll send that to you.
Okay.
Are you saying if we remove the smoking issue, we can get
Yep,
funding for
because
that? Is that-
We cannot
Yes.
any longer get funding for the smoking,
But if we take
Yes.
that out, we can,
but they could do, I think, what else can you can do diabetes, isn't that under the health promotion? So they could do,
okay.
But they're.
Yeah.
I mean, that is-
out of the HFI funding, they took tobacco out of there. Yeah.
Yes.
But we could still use it for other chronic diseases, healthy living, that kind of stuff. I just did not get that contract for Vanderburgh.
so the contracts that we received are draft. They have not been approved by our
Yeah.
council yet. And we also have to add not to exceed value. So Vanderburgh thought, I think I sent this out to you guys,
Mhm.
50 to 75 for PRETA 3.
Yeah.
That could be more depending on how many people apply and that we take in here, then 20 to 30 for communicable diseases, and 10 to 15 for health promotion.
So those are just their estimates.
Their estimates, they can always come back and say, hey, we finished with this money, we have this much more, then we can renew that. Absolutely.
But the contracts aren't ready for us
The
to
con-
approve
But
yet.
today we could recommend sending those contracts to the commissioners once the
Subject to.
attorneys have approved it with these not to exceed
And
values.
you're satisfied with the number that Joe provided?
I think they kind of looked at what they've been doing in the past couple of years and said, this is pretty much
Projected
where
it
it's at
forward.
right now. Especially since I think they're thinking small as they train Warrick, and then Warrick takes over, so we won't have to spend everything for them.
So before we approve that, I think, and Debbie, you might want to speak to this. So I think the funding is going to come out of the HFI funding, so we'd have to get it appropriated over to the contract services once it's awarded.
Right.
So I think step one today would be if you guys award if you want to propose to the board awarding the 3 contracts relating to the 3 that they proposed. One that we received was tobacco, but it was combined with something else that is allowable, so we could go back and remove the
This
tobacco
one.
piece and negotiate that. I also have the Vanderburgh County Health Department looking into where they came up with the charges on those contracts, just because I figured that would be the one question people are going to ask, where do you come up with these dollar values? And I'll follow up with Mr. Grease on that. He's the administrator. And then I think once you guys recommend it, with the next step,
Then the
Be-
next step
you have
is
to go
go
to
to the
the council.
commissioners, and then we go to the council, right?
So first of all, there wasn't scope of services in those contracts. So we definitely need the scope from Vanderburgh County, what they're doing, the amount per hour. Are they doing the reporting? Are we doing the reporting? Except none of that was mentioned. And then the amount and the not to exceed. And once those are reviewed, you can recommend that the commissioners approve them, or you can approve today subject to, but then we have to go back to county council and get the money appropriated, which won't be till July now. Because we've missed, the June meeting was today.
oh,
So,
But we're already on there. That's what we talked to them about last time.
and they
because-
said without dividing it, you could go ahead and appropriate? Okay.
Well, no. We'll have to go back to them and tell them what we're going to use that. We tabled it at the last meeting,
Yeah, I was here.
and they know
It's on the
we
agenda.
were waiting on this dollar amount to talk to them on the next, we're still on the agenda for the next meeting.
Okay, I would double check with Crystal that you could do it first, and once, because you can't award a contract until the money's appropriate.
Right,
So
right.
it still will be.
Exactly.
June meeting.
and I'll send you the contracts that I have, because they have, I think they have a scope of work and
Yeah.
price.
I was gonna
Yeah,
say,
the ones that I got did not.
Okay, the ones I had an hourly rate.
And it
depending on
basically
who was
said that
doing
they're
it.
going to come out,
Yeah.
set up their training, their forms, their
Okay. The one
documents,
I
get the
had did not
program.
have all that detail.
Gotcha.
Okay.
Yeah.
Yeah, then once you have the money, then the commissioners can.
So we need a motion today to,
To
Ex-
award the contracts, because we put out an RFP, award the contracts to Vanderburgh County for their proposals.
pending attorney approval.
Well, first you award them and then ask me to review the contracts and follow up with Vanderburgh County, negotiate once those. So yes, you can make them subject to attorney negotiating, getting to a final point. I'll still share it with all of you so you can see what it is in case you have questions. And then once that's good, then we go, I guess, to the county council, get the dollars. Then you go to the commissioners, because they can't sign a contract until money's appropriated.
Right.
So
So is the
That'd be
not
a
to
process.
exceed language in the current proposal? or-
No, we have to
no,
add
but
that
that's something
number.
we're gonna have to, we were
So
gonna
Can
add.
that be part of this motion?
Yes.
Yes.
Okay, and I have a question too. So Vanderburgh County before was providing STI services for the Warrick County Jail because Warrick County was not providing those services. Is that going to be included in the proposal for the contracts?
It can be, yes.
There's not currently language in there that I saw for specifically the jail.
Okay. Do we want to add that?
I'm okay adding that if we've already been.
How is it happening now then? Is there a separate contract for it now?
I honestly don't know how they're doing it now.
Right.
I don't even know that they
'Cause
are
we wouldn't-
doing it
we
right
wouldn't-
now.
We wouldn't,
I
We
don't
wouldn't want
know.
to disrupt.
Yeah, I don't know that they're even doing it now, right now, to be
Okay.
honest with you. I don't know what they're doing.
I could follow up with Sheriff Wilder, see if
Yeah.
if Warrick or Vanderbilt County is doing the STI testing. And are you guys saying you want that to be like separate from this contract, or they're not charging us for that one? Or if there's already a contract in place, make sure that
Mhm.
all this STI services is for everything outside of the
We just need
jail.
to get it into one spot.
Yeah,
Rather than
I was
having
gonna
it in
say.
15 places.
Yeah.
Yeah.
Because it would be a service we would provide.
Yeah.
And then I guess the only other thing I would mention is they have proposed, Vanderbilt County's proposed their max limits. That would have been a question I would have asked you guys. If there's a certain amount that you want to have, are you guys okay with what their recommendation is? I know that Joe in his email says repeatedly the pre to 3 money could be gone real fast. So
Well, and I think just because we don't know, that we'll have to.
that'll be a trial run.
A trial run, they might have to come back and say, yeah, we need more money for this, or we're gonna have to do more, but
Cross that
So
bridge
if we
when we
look at
get
the
there.
history and kind of, it's an ideal, I guess that's kind of what he did on his initial proposal, correct?
Is there a qualification for pre to 3? Like, do you have to be a
So
certain?
currently, the request before the council is to put all of that extra money in contract services. And so if they approve that, you just tell them they want to know what KPIs they were going to do. So the appropriation, if we're doing a contract, is for those contracts. You just need to tell them how much of that money you want appropriated right now for what KPIs, or you could potentially ask them for all of it. But from there, you can pay Vanderbilt County. It's in 1161.
Like for the grant, or for the people that participate, is there like a household income that they have to be under to participate in?
So pre to 3's program has typically been that it's any resident in Vanderbilt County.
So it doesn't
Just
matter.
flat out,
Okay.
period. So that's one of the best inclusion factors about it, because a lot of the state programming right now for home visitation has different limits on it. So you either had to have Medicaid eligibility, or you're a first time mom, or you're within so many weeks. But pre to 3, it's any time of the pregnancy all the way up to 90 days postpartum, which is what made it ideal, because if then you found somebody in the hospital who didn't have home visiting, you could still hook them up, and it's still a huge benefit.
So it could be a lot of people then.
It
I mean,
could-
it could
It
potentially.
could,
Yeah.
it really could be.
Yeah.
But it just, home visiting does take some of the buy-in though too. I will say that, like, even when you do refer someone to it,
Yeah.
welcoming someone into your home takes a minute.
any other questions?
So I make a motion that we award the contract with the stipulation of
The 3 contracts.
3 contracts. Thank you. With the stipulation involving the not to exceed proposal that I don't have in front of me, but we have it, right?
Yes, we do. It's 75K for pre to 3, 30 for communicable diseases, and 15 for health promo.
That covers?
Are you going to add
With-
the jail thing?
With approval, from-
Subject to legal reviewing, negotiating questionable, or confirming the pricing and adding in any required language. Like we'll have to add E-Verify. I noticed wasn't in there, and that's required in all service contracts. So things like that.
So moved.
You're doing good.
Can I add an addendum to
Yeah.
include
Sure.
the sexual aid, STIs to the jail?
I second all that.
Any discussion?
All the above.
All those in favor?
Aye.
Anybody opposed? Okay. Okay, got your contracts.
All right, thank you.
All right, staff report from the health officer.
Only other thing I have outside of everything so far, just so you guys are aware, I am going to be out of the country May 21st through June 2nd. So just want to make sure you guys were aware. All right.
I've only heard that 4 times this week. Thanks for rubbing it in.
And then you followed up telling me where you're going to go.
So is there someone that has to be in your place while you're gone?
I was going to ask actually Erin that, like right now I have given Julie all the signing authority. But the one thing I still always sign is her claim for her to be paid. I don't know how, I hate for her to not be able to get paid while I'm gone. If somebody could,
So you can designate an employee of the county to
Okay.
do any duties. So you
Okay.
could designate Debbie.
Okay.
That's who I'd recommend.
Okay.
Let me ask a question about that, because in all the year and a half that we've had a lot of different changes and had vacancy and all that, there were some things that the coroner complained about at one time when there was no health officer sitting in that position. So was that signing death certificate?
Yeah, death certificates,
Yeah.
which they have my stamp and Julie
They
has,
can do
they
that
have,
in
they
your
have that,
absence.
all
Okay.
that
Okay,
authorization
that's
to
all I
already
wanted
do
to
it. Yeah.
make sure.
So,
Perfect.
Cool.
any other questions?
Contract administrator and finance.
Julie Shade, contract administrator. I have been working with the staff and getting familiar with what they do. So that's kind of where I've been with that. More importantly, I've been working on the financial side of things. I have worked on the HFI budget for 2024. I had to fix it and resubmit it to the state in red cap so they had to send me the corrected financial report so I could finish that. So I'm almost finished with that. I have a few things to do with it. I'll either get it finished tonight or tomorrow and submit that. So that will be done. We will be able to close that out with them. Then next I will start working on the 2026 budget. All of them by June 1st, just because HFI budget has to be turned in by June 1st, and I can't really just figure that by itself, so I have to do it all. So that's what I'll be working on. Then once I'm finished with that, I will start restructuring this year's HFI funding. This will allow us to use the money that was appropriated for salaries. There's so much in there that we're not using, so we can do more partnerships and programs that we should be doing to meet those KPI and core services through the state. Where we can take back some of that stuff that Vandenberg's doing and do it ourselves, like STI testing. We should be able to do that ourselves. I don't see a very long time frame where that'll be happening. All those chronic diseases, there's lots of things we can do. I've already talked to Purdue Extension about doing dining with diabetes, matter of balance, and things like that. So those are programs that are good for the community and getting out there doing that. So as I've been navigating through the areas of the health department, I have found there is a need for a better system when it comes to tracking money, issuing receipts, and basically structure of the finances. I would like to see about using a program that actually Gibson County created with Parish Consulting, which is who we use. It was designed specifically for us to manage receipts, print out receipts, all your septic stuff's on there, foods, anything that you need like that's on there. It prints out financial things for me to be able to do weekly deposits, how many birth certificates, death certificates, testing, all that stuff. So it's very important to have that and to tell you how good this works for everybody. And it's very user-friendly. Posey County and Davies County now use it. So I would very much like to get that implemented into our health department because I think it will be a valuable asset because right now I'm trying to go into the financial things, figure things out. We have one out that does the stuff and not everybody knows what's going on. I'm a firm believer in we need to cross-train and this system's easy that if I'm not there, somebody can pick it up and pull what they need to pull out of it. So that's one thing on the list that I would like to get started to make this more functionable for everybody and things aren't getting lost, overspent, missed, that kind of thing. So it'll help us. Planning going,
Is there a cost associated with it?
there is. So what I'm going to talk to Debbie about, once I get the quotes and stuff, I want to talk to Debbie about maybe, I think whenever we did it, so Gibson County took the blunt of it by creating the system. So all that had to be done. So they took more of paying for it where it's not going to cost everybody else as much. I think depending on what we do and how we're going to do it, if our IT person can help, then, or if Parish has to help with it and monitor it, whatever, we'll figure that part out. There is a little bit of different cost. Work with Debbie on maybe using grant money. If we have any left trust and maintenance, I believe we could probably pay for that out of there.
We
So,
don't have any trust and maintenance, but we have old grant money.
okay.
Is it compatible to But does it need to be compatible to our LAO system?
I don't know. I'll have to talk to them and see what, we'll have to get into the logistics of all of it, but I mean, he can make it work probably, I would say. So we'll just see what he
Is there
says.
a monthly fee? Or do we-
There could be if they have to monitor and do the things if our IT person can't. And that's, I think it was like $1,000 a month or something, whatever with that, but we'll work on that. That's just something I'm thinking about so you guys know. Planning and going forward, hiring the new administrator, programming and outreach is top priority to meet core services and KPIs for public health in Warrick County. So that's what I've been working on and what I will continue to work on. You guys have any questions for me?
The one thing I would suggest is maybe what you were seeking is approval from the board to work with Debbie, Sherry, Guy, to look into this new technology, see if it's compatible, figure out what the quote is, the cost, make sure you follow the right process with Sherry. And then if you guys give your blessing for her to move forward with that, then the next step after you hammer that all out would be to go in front of the commissioners, part of the purchasing process.
Okay.
So that's what I'd recommend if you guys want to make a motion.
I'd like to know more about the cost and all that stuff.
Yeah.
Yeah, so can you just do some work?
Once I get that and I get quotes,
Yeah.
I can email you guys and let you know what I'm working on with them and what it all entails.
We had recently talked about a different computer thing that we thought cost X and it costs 5X.
Mhm.
So I
Right.
just
Yeah.
wanted
No,
to know what it
I
is.
agree.
Yeah.
Definitely.
Yeah.
Anything else? Okay, thank you.
Administrative
Thanks.
Assistant, Sydney?
Sydney Little. Last month, just aside from the daily duties on the 1st, several employees from the health department attended the active shooter training that happened here in the courthouse. I was one of them. And afterwards, we went back into the office and came up with a plan. If there were to ever be a situation that we would need to have a plan in, we did come up with a plan. On the 9th, Jacob Brown from Heartland Interpretation reached out to our office, wanting to tell us about his services in the business. And he did email me a few flyers and information, but I have those if you guys want to see them. If not, we can wait until the next meeting if we need to get more information. Wait until next meeting.
Okay.
Yeah, okay. I also sat in on the TRICAP Social Concerns virtual meeting on April 23rd, which was cut short because we didn't have a microphone, so we weren't able to introduce ourselves, and talk. Jackie attended the Indiana Vital Records Association meeting in Vanderburgh County, and she came back and relayed that information to me. That was about amendments. She really didn't say if there was anything new. It was kind of a recap of what we had already known. I have also accompanied Angelina, our sanitarian, on a couple septic inspections. That's just for her comfortability, so she's not out there alone with, grown men for safety. And then I've also been assisting Julie in providing any information that she's requested to complete the 2024 HFI annual financial report.
Awesome. Do you guys have any questions for Sydney?
Thank you.
No, thanks, Sydney.
Yep, thanks.
Thank you.
Jackie, Vital Records?
Oh, jeez.
No? Okay. Food Sanitation? Tina or Katrina?
Sorry. Katrina Sizemore, Inspector of Food, Permanent Makeup, and now pools. So we had a really busy month, Tina and I did. We did 47 regular inspections, so that would be food, our food or permanent makeup, hospitals, things like that. But we are really working hard on implementing our new pool inspections that we are taking over. So we have done a lot of trainings this month. We've been in Indianapolis like way more than we want to be. So April 2nd and 3rd, we had 2 state employees that are specific for pool inspections. Steve Urey and Barb Ninke came into town, and we went to several of our pool establishments just to have them walk us through it. It wasn't an official inspection. We let them know that when we set them up. And we went to a couple apartment complexes. We went to one of our gyms. We went to Boonville High School. And they just kind of showed us the ropes, how to do those inspections, what questions to ask, what we're supposed to look for. This was our like very first introduction into pools. On April 24th, we went to Indianapolis for an all-day pool conference. And then the April 29th and 30th, we went back to Indianapolis and we did a 2-day certified operator course. It was a very, I will just say for me, it was very difficult. We had homework. We stayed up late. It was crazy. We had to take the certification test at the end of the 2nd day, and we both passed. But it was not easy, but I'm proud of us because we passed. So we have been really, trying to get the pool part started in addition to the food and makeup. There's a lot of inspections that have to be done. So we're trying to figure out scheduling, who's going to do what pools, things like that. We're trying to jump in and get it started, but we want to obviously look like we know what we're doing when we're doing them. So we have been just doing our best to get trained on that. There's a new splash pad coming in to Boonville. So we've already gone out to that site where we've been involved in as much as we can be. We did get all of the plans obviously very late because they've already started the splash pad. We did send those plans. The 2 state people that I spoke about, Barb and Steve, they looked over those plans in extreme detail, and they did find something that the splash pad is lacking. And I just want to let you guys know because I don't know if something further is going to happen with this discovery, but there is a filtration system. It's a secondary system that they do not have included on their plan or in the works for their new filtration system at the pad. And it's a UV filtration system that filters out I'm going to say it wrong, cryptosporidium. And so it's a huge thing that they're needing to do. So Steve kind of took over. We had Zoom meetings with them. We went out to the actual pad itself, and it has to be on there. It's not an option. The company that is building the splash pad, they are trying to get it done. The problem that they're coming into is that the splash pad itself is supposed to be done by a certain date. And I guess they signed a contract with the city saying that it would be up and running by this date. If it's not up and running, then the company agreed to a $5,000 a day penalty for. The date is May 31st. Yes. So if it's not up and going by the 31st, this company signed a contract that they would have a $5,000 fee per day. So we had the state take it over at that point because Tina and I just did not feel confident. And so Steve Urey took it over for us, and he absolutely said that it has to have that secondary filtration system on there. It's not an option. He actually went above and beyond and found other companies that they could get it from. I don't know that they're going to do that because it sounded like maybe this was a competitor and they didn't want to do that. So it's in their hands right now. We haven't heard anything else back since they were told that it had to be put on there. we haven't got any other feedback other than thank you guys so much for helping, and we're going to do what we can do. So I don't know exactly where that is in the process. We haven't heard anything else beyond that. We went to a conference on April 10th in Indianapolis. April 16th, the new food code was implemented. I took all of the new food codes that we were given. We've sent all of those to our food establishments, our restaurants, our food trucks. So they all have the new food codes. They knew they were coming, but they finally got implemented. So they have all of that. They know what the new codes are. We also told them if they have any questions with any of the new stuff, just to reach out and let us know. We also did a Zoom meeting with we talked last time about we're wanting to get a program that we can do our inspections on that keeps them all in one spot. We had talked about Fetch. Since that fee was so expensive, we started calling other counties. We called several, actually Chris did it for us. And a lot of the counties mentioned Inspect Hub. So we had a Zoom meeting with Inspect Hub, and she went over the program with us. She went over the cost with us. I have it, but I know Julie has it too. They gave us a quote. It is so drastically, the cost is so much less than Fetch. And it really felt like it fit well. A lot of counties use it. It is the program that Vanderburgh was using prior to Fetch. So we have a lot of people that are familiar with it that can help us. And they've already reached out and told us if we need help, getting it, like if we get stuck on anything, they can help us because they're familiar. Several counties have already told us that. So we do have a quote.
Yeah, we're just letting you know about it.
Yeah.
We're still gonna talk about it, look at it, and then
Yeah.
this other program, we're gonna just.
Yeah, because you guys had mentioned wanting more quotes. So that's why we did this one. So this one, yeah. And we like this one. It was great. They have, they're also really good about, if we need any, kind of help, that it's all incorporated in the quote. So, when they're ready to share, they'll share what that quote was, but I can tell you that was a lot less expensive than Fetch. So, that's it for inspector side.
I have a question.
Uh-huh.
On this, like the new splash park, and I know we're getting a new pool, is there a way that you guys know about these when they're planning it so you guys can look at them ahead of time? Is there
Yeah, and that's how it should have gone, but because we just got the pools, as soon as we were told, Tina made a call to get the plans, and then we were out there, within days.
so like if somebody comes to here to get, I guess, plans approved, is there a process for whoever here to let you guys know?
Yeah, they should be filling out paperwork and submitting all of that to us prior to it starting.
Okay.
But like I said, we're trying to get the ball rolling on the pool inspections and the whole pool program. So we're kind of learning as we go as well. But we do the same thing with food. So we, as far as food goes, I think we've got a good communication system going with like area planning and building. And so we've been communicating quite a bit with food. So we just need to get that same system going with the pools. And then once we were in the know of taking over the pools, it was already, everything was like, already holes being dug and cement. We were able to stop it before the actual cement pad was laid because we wanted to look at it. We didn't want that expense and then have to come back and say you're missing something. So they did grant us that. We did get in there before that cement pad was poured. We didn't see anything that should hold up that part of it. And then, we dove into like the filtration system, and then that's when that part of it was caught. So.
Any questions? Thank you.
Okay.
Thank you.
Congratulations.
yes.
Yeah.
Yeah.
That's all.
Yeah.
General sanitation, Angelina?
She's gone. She did give me a little report for her. She's been working I'm Julie Shade again, our contract administrator, speaking for Angelina Preibel. She is the environmental health specialist. She's been working with Colin Ward from the state on different trainings focusing on improving site review inspection processes, what kind of complaints and how to handle those on the septic side of things. Learning more about soils and the means for septic systems being put in, working on familiarizing the floodplain, signing off on plats before giving them to Area Planning Commission. Also training, she went to training in Pike County reviewing Rule 410 IAC 6-8.3. On top of that, which I'm not sure, I have to look into that, see. On top of that, she has been, let's see here, doing the specifications, issuing permits, going on site inspections, doing complaint investigations, and helping cover the front office when it needs to be covered, on births and deaths and scheduling appointments. So, okay.
Public health, Regina? She's not here. Sarah?
Good evening, Sarah Godshell. In April, we did 9 school clinics, Sharon, Yankeetown, Logue, Chandler, Linville, Elberfeld, Tecumseh, Boonville, and Castle High School. Numbers are generally down in the spring. We saw a total of 15. There were more kids registered, but they were up to date, so we didn't see them for shots. The school nurses, we can't thank them enough for their help and help continuing to grow our school clinics. They're already starting to schedule the fall clinics for the flu and school vaccines. They suggested that we put our yard signs back up at student drop-off points. We did that a couple years ago, but half of our signs went missing. We don't know that if when they were mowing, they pulled the signs up and didn't replace them, so we will have to see about replacing some of our signs, but we did have a larger turnout that year that we had the yard signs. We also provided dental kits to the kids who were registered at the clinics. We also did immunizations and TB testing in the office. We did see a total of 22 people for 51 vaccines. Tuberculosis therapy has continued for active disease and latent infection. Directly observed therapy visits totaled 44. Those are 5 days a week. Medication pickup for latent infections are going well. They're all being followed by private providers. We will be starting some new LTBI regimen called 3HP, which is isoniazid and rifapentine. These are weekly DOT visits, and it lasts 3 months. We are doing continuing education for TB. Recently, we did raising TB awareness and enhancing public health practices, and ongoing case management for nurses through Rutgers. Communicable disease reporting, we completed 36 for the month of April and have noticed the increase of animal bites just due to the weather warming up. We participate with the local emergency preparedness committee here at the Warrick EMA office. We were at that meeting on the 23rd. And then upcoming conferences, June 10th is World TB Day, which was postponed from March. That'll be in Indianapolis. And the Public Health Nurse Conference is scheduled for the 24th and 25th of June in Carmel. And St. Vincent's Warrick reached out asking if we would possibly be able to participate in their 50th anniversary celebration in August.
Are we doing anything special with all the measles?
I did do a reminder recall for those who need first or second dose of measles. There was, of the list that I can recall, which is only people that we see that we own for our facility, I sent out about 15 postcards.
Did we do anything, like send anything to the schools or anything?
The schools have tried to go through their list, and when we did the school clinics, we did get one kid who was not up to date.
Yeah, if it's possible to send something out to the schools, even especially over summer with people being home, I think that's going to be really helpful. Just knowing that it's an opportunity to increase vaccination, but also just knowing that people start gathering and that's kind of that prime opportunity for it. I think it would be helpful, even if you just send it out universally, you never know who might not be up to date. But
Or who they may know.
yeah. The other one that I was really surprised about hearing recently too is just about congenital syphilis. Like seeing cases of that
Yes.
has really risen. So I didn't know if that's anything, if y'all have heard about that much either or have seen it, but it's very concerning because I know that people are tested multiple times even before they come into the hospital, but it's still, it looks really bad when we're one of the highest people
Yes.
in the state with it. So I don't know if we're seeing it in other counties too, like Julie, if you've seen it anywhere, but it's, yeah.
Anyone else? Thanks, Sarah.
Thanks, sir.
Chris Crow?
So I'm going to give a little update for Chris, Julie Shade again. In April, they did an exercise class, or Chris did an exercise class at the Warrick County Council on Aging on Wednesdays at 9. There was 52 participants for that month, with some education, a new method of balance and ways to better our health, which falls in lines with the chronic disease prevention KPIs. Every Monday at 10 at Primal Foods Trailhead, walkers are meeting right now to join her through, did that in April. There was 24 people walking in April. She's still continuing to do that, their walk in May, but plans to move to trail. They're still doing the walk in May this month for at Prime Food Trailhead. And then they're moving it to the Deaconess Trailhead on Anderson Road in Newburgh in June. So, and then she co-attended the TRICAP social concerns virtual meeting, and regular duties were performed in assisting vital records.
Do you guys have any other questions? Great, thanks a lot. I did hear a lot of thanks for you guys being at the council meeting and the commissioner meeting to give a little update. That was very nice. They said that's the first time that's happened that they can remember, so very nice. Anything else for them?
Just a thank you for everything you all have been doing.
Yeah.
Thank you very much.
Next board meeting is 6/11 at 4:00. Is there any public comment?
Do you guys have to have the meeting that day?
Huh?
Do you have to have the meeting that day? I mean, it doesn't matter. I didn't know if you can move it a week or you have to stay on the day.
We can move it.
I'm okay with the next week.
Dr. Murray.
It's Dr. Kari already.
Maybe the 18th. My opponent's an EMS conference I go to every year.
Blame it on me.
Way to go, Tony. You want to do it the 11th or the 18th or 25th? Does anybody have issues with those? 18th is out.
18th is okay.
No, it's out.
Let me double check.
Wait a minute, she's double checking.
I'm on the 18th. It's on the 17th. I have a meeting.
18th is okay? 18th is okay?
You can do the 18th.
18th is fine. We can do that. We can do the 18th. Is that okay for you guys?
Yeah.
Okay. All right, next meeting is June 18th at 4. Do I have a motion to adjourn?
Motion.
Oh, wait.
Hang on.
Oh, okay.
We'll be here by then. We'll be fine.
Okay. Do I have a motion to
We'll
adjourn?
be here.
Did you make a motion?
I'll make
Leanne
a motion
did.
to adjourn.
I'll second.
All those in favor?
Aye.
Anyone opposed?
No.
Meeting adjourned.